Hello, dear parents. Topic for today is teething. I think most parents can relate to the most difficult time raising their kid was during the time of teething. Maybe adolescence, yet teething is by far the most difficult time which most parents face. So let us try to know more about teething. Most information which is available to parents is passed on from generation to generation and from parent to parent. Yet, through knowing more about it through science, we can be less afraid about the time of teething. Most of the children start developing their first pair of temporary teeth from the age of 6 months. They continue to develop 20 more teeth until the age of 3 years, which are called the temporary or deciduous teeth. From the age of 6 years until the age of 13 years, the child develops the permanent teeth, which is around 32 in number. Most of the time, parents feel that they don't know when the time of teeth appearance is. So, let us try to know in brief. The lower incisors, that is the central teeth, appear by the age of 6 to 8 months, while the upper ones appear by the time of 7 to 8 months. While the lateral incisors, lower, appeared by the age of 9 to 10 months. Similarly, the upper lateral incisors appears by the age of 10 to 11 months. Then the first molar appears by the age of 14 months. Then the canines appear by the age of 18 months, and then the second molar appears by the age of 20 to 22 months. Now, coming to the most difficult part, that is what to do during the time of teething. I guess most parents must have faced a lot of difficulty during teething. The most common complaint is that the child is excessively irritable. Why is it so? It is seen that 4 to 5 kids out of 10 develop some amount of irritability during time of teething. This is because the hard teeth passes through the soft gums, causing some pain and inflammation, which causes the child to be slightly more crankier. Occasionally, the parents feel that there is change in behavior and my child doesn't sleep at all. It is known that most of the kids start developing drooling, that is excessive salivation, once the child develops teeth. This is also because of the inflammation of the gums. Yes, it is known that the child develops a lot of drooling during the time of teething. You can as well use some cloths to wipe it off and ward it off, since drooling is not a major illness. Is it that my child develops more amount of fever during teething? Yes, some amount of rise in body temperature is known because the child is more cranky, he cries a lot, which causes some amount of rise in body temperature. Also, the inflammation of the gums can cause some amount of rise in body temperature, but this is never beyond 100 degrees Celsius. If you feel that the child is consistently having a temperature of more than 100, then you have to seek your pediatrician, because during the time of teething, the child puts a lot of things in the mouth which can cause some infection and cause the rise in fever. Coming to the fourth question, whether the child has diarrhea and vomiting during the time of teething. Actually, teething per se doesn't cause any diarrhea or vomiting. Yet, as I have told in the previous example, the presence of putting the things in the mouth can generate this incidental increase in the incidence of diarrhea and vomiting, because the things which are put in the mouth can be a source of infection leading to diarrhea. So, per se, the teeth doesn't directly cause diarrhea, yet it may be an association. Another commonly asked question is, will it cause development of cough in my child? As I have told, there is increased amount of drooling, that is salivation. Most of it comes out in the forward direction, yet some of it might go backwards and elicit the cough reflex. So some amount of cough is known to be associated with teething, but it is not a primarily caused because of teething. The other things which parents tell about ear pain or conjunctivitis or other things which are known to you are never direct associations of teething. Hence, teething per se causes only these problems. Any other thing may be a rare association which you need to discuss with your pediatrician. Are there now the main question arises, are there any remedies to it? Can anything be done to prevent the problems associated with teething? So these are few tips which I can suggest you, which can definitely help your kid to to have a positive sense during time of teething. Invariably we have seen that kids get some amount of relief with gentle massaging of the gums. So after you clean your hand thoroughly, gradual massaging of the teeth of the gums forward, backward and above in slow circular motions definitely helps some amount of pain relief in teething. So also a wet cloth which is dipped in cold water may be applied to the gums, which also produces some amount of relief. Apart from this, very important thing to do during time of teething is that apt attention to hygiene is a must. This is because the child keeps on putting things in the mouth. What we can do is, since the child doesn't walk right now, you can clean and take attention about cleanliness of the area surrounding him. Especially take good care of his toys, because these are the things which he keeps mouthing. So proper antiseptic solution use around him and for his toys definitely goes a long way in preventing the appearance of recurrent fever, also prevents diarrhea and vomiting in such kids. Some might use it as a time to introduce solid foods in children. It is known that children keep biting on things. So cold carrots or cold cucumber given to the child keeps on nibbling on them. Definitely helps soothing of gums. Also is an opportunity to start the introduction of solid foods in such children. Apart from that, the other measures of using those numbing gels or using the beads or things to chew on are not the right choices. Some pacifiers or artificial teething agents which are soft, if cleaned really well, can be used to prevent the pain of teething. Of course, nothing can beat breastfeeding. So whenever a child becomes more irritable, definitely feeding the child produces a sense of positive comfort and the child is more happy breastfeeding and the pain of teething gets relieved. So also some amount of distraction definitely helps. You must have noticed that the child is more calm during day and is more crankier during night. This is because during day he sees things, people are walking around and he interacts with them, plays, and his pain is mitigated. But at night the only stimulus for him is the slow gnawing pain of his gum eruption, teeth eruption. So at this time, if the parents produce some amount of distraction, they can definitely avoid the pain associated with teething. Now, the other important question which parents ask is that my child has late onset of teeth. So when is it called as delayed dentition? It is told that according to Indian Association of Pediatric Dentistry, beyond the age of 10 months, the child doesn't develop any teeth, then we have to worry about it or seek help from the dentist. So also Indian Association of Pediatrician helps the children beyond the age of 1 year. What happens is, if the child hasn't developed any teeth beyond the age of 1 year, then the pediatrician will assess the nutrition and health of the child. Sometimes we might prescribe you calcium and vitamin D3, which are essential for development of strong teeth and bones. Apart from that, certain genetic, familial and local issues are known to cause delayed development of teeth. Another common query is, when should I start brushing my child's teeth? What is advised is, even before the teeth erupts, the mothers should gently massage the gums of the child and clean them every time after feeds, every time the child is put to sleep, because the gums can get infected. Of course, you have to start brushing immediately after the first teeth erupts. So initially what we can do is, you can use a finger brush and gently clean the new teeth which is erupted, along with attention to the gums. As the child develops more and more teeth, you can start using brushes with soft bristles which can clean the teeth of the child. Now, another very important question is, when should the child be allowed to brush by himself? Sometimes parents also tell that my child doesn't like brushing or he is cranky when we start brushing the child. So what we can do is, as we start this process, we have to start getting the child excited about this time. We can use this as a sort of play and make it as a game for him. Brush the teeth on all three directions, in front, behind and on the surfaces, and let the child try to do it himself, and until the child develops some amount of dexterity in using his hands, the parent should supervise. Sometimes it might take as long as 6 years until the child takes care of his teeth well. Every time the child finishes brushing, you can ask the child to come to you and ask him to open his mouth, and if he has done a good job, then you can applaud and appreciate him, or else you can also take care that he doesn't leave any food material, because this can be a source of decay. Another important question is what kind of toothpaste we should use for the child. It is advised that the toothpaste which contain less than 500 parts per million of fluoride are good for younger children, while the elders can use fluoride up to 1100 to 1500. What fluoride does is, it prevents the decay of the teeth which is generated by the acid from the bacteria and food particles. So I think these are the most common doubts associated with teething, and I have tried to comprehensively address most of the queries. There are a lot more problems which parents face. Definitely pediatricians are there to help you. And I also advise that every child at least once by the age of 1 year should seek help of a pediatric dentist. I think this has explained most of your queries. If there is anything else, please leave a note in the comment section. Thank you.